My name is Dr. Mukesh Goel. I am a senior consultant in cardiothoracic surgery and heart and lung transplant at Indraprastha Apollo Hospital, New Delhi. I deal in disease of the heart in adult patients, which can be coronary artery disease, which is a blockage for the blood supply of the heart arteries, or leakage or narrowing of the heart valves. I also treat aortic disease like dilatation of the aorta called aneurysm, or there is a tear in the aorta called dissection of aorta. I deal with heart failure patients who require artificial heart or LVAD, or they need transplant. So main disease which affect adult patients related to the heart are blockage in the coronary arteries, which we call atherosclerotic coronary artery disease. So there is a buildup of calcium and atherosclerosis in the arteries of the heart, which leads to decrease in the blood supply to the heart muscle. So the patient might feel angina, that is whenever he starts to do some work, walking or climbing upstairs, he start feeling choking or discomfort in the chest, or sometime it can be even continuous chest pain at rest also, leading to heart attack. So for these disease, we diagnose by doing angiography, which shows if there is a blockage in single or a double vessel, which can be treated with angioplasty and putting a stent without operation. But the patient, if he has got disease or blockage in all the three arteries, and the patient especially he is diabetic, then he needs a bypass operation. Nowadays also we can do bypass operation not through the regular way by cutting the chest open in the midline, but by making a small cut on the left side and robotically assisted minimally invasive bypass. The robot, the Vinci robot we are using at Apollo, which is the latest generation, and this helps us in taking down memory artery without much pulling and straining, and the patient is very, very comfortable after the operation. Then because of the heart valve blockage or leakage, the patient may feel breathless, dyspnea while doing any work, walking or even climbing stairs or doing any kind of a routine work. And then we diagnose heart disease by doing an echocardiogram. So echocardiogram shows which are the valves are affected and whether they are narrow or whether they are leaking, and whether they can be repaired or we need to replace the valve. There are two kinds of valves available. One is mechanical valve and other is derived from the animal tissue or tissue valve. So the basic criteria whether one should go for mechanical valve or a tissue valve is the age of the patient. The patient who are generally younger than 50 years, mechanical valves is implanted, and patients who are generally more than 60 years, a tissue valve is implanted. It is like this because the tissue valves, a normal lifespan of a tissue valve is 12 to 15 years. And then they need 50% of the patient then will need reoperation for the tissue valve. Patients who are between the age of 50 to 60 years, they can decide according to their convenience how they are comfortable with. Because with mechanical valves, these patients have to be on warfarin for lifelong to keep the valve flowing. As I just talked about robotic assisted bypass, the same is now available for valve replacement. If somebody needs only a single valve replacement and without any additional bypass or other procedure, we can do it with a small cut on the side of the chest. It is called minimally invasive cardiac surgery. So the patient gets discharged to home within 3 to 5 days after the valve replacement if we do it by the minimum technique, and can resume his work after 2 to 3 weeks. Then for heart failure, when all the medicine have failed and the patient is continuously symptomatic and he is not getting better, or his other body organs because of heart failures like liver and kidneys are getting affected, so these patients need transplant. Transplant is for the heart transplant organ we get by what we call brain dead organ donation. So the patients who get injury because of some accident or some bleeding in the brain or some inoperable tumor in the brain, and if they became comatose, deeply comatose, and there is no chance of recovery, brain tissue is dead. So the family can be counseled and requested that they can opt for organ donation and save many lives by donating heart, lungs, liver and kidneys. The patient who are not fit for transplant, they have to have a artificial heart called LVAD or left ventricular assist device to have a meaningful life, symptoms free, and to increase their lifespan. If these patients who are in terminal stage of heart failure, they just remain on medicine, the average lifespan is 1 to 2 years. But with LVAD, this lifespan increases to more than 8 to 10 years. So that is a huge benefit for these patients. So thank you very much. It's nice to be in Yangon and Myanmar.